About a year ago, on a morning that seemed ordinary, I was in the operating room. In front of me, a 67-year-old man, a patient like so many others. But what I found did not seem human. Its arteries were not flexible. They weren't elastic. They looked like concrete tubes, rigid, unyielding. And what makes that disturbing? He was taking 4 medications for blood pressure. 4! And yet, his blood pressure remained dangerously high. He was not negligent. He did not ignore his health. He did everything the doctors ordered. And yet, I was in my operating room. Have you ever felt this way, doing everything right but with no results? It was then that I realized something that completely changed the way I treat patients. His problem was not a lack of treatment. It was a lack of strategy. A strategy that conventional medicine often overlooks. And today, I'm going to show you something that most people never hear in the office. The solution was inside his kitchen all along, and in yours too. Most people believe that high blood pressure comes from stress, salt, and age. Yes, they contribute, but that is incomplete. It's like only looking at the tip of the iceberg while the whole mountain is submerged. Imagine your arteries as a new hose, flexible, adaptable, alive. Now imagine that hose after years in the sun, exposed to corrosive elements. The true enemy is chronic inflammation within your arteries. Think about it. Your arteries are blood vessels that need to be flexible, rigid, dry, fragile. This is exactly what happens to your blood vessels after 40, and often much earlier. Hardened, lacking elasticity, vulnerable. That's how many blood vessels change after age 40, silently, and sometimes much sooner than you might imagine. And when the blood tries to pass through a rigid tube, the pressure rises. It's pure physics. But here is the most important detail. What most tests do not show, this begins years before any symptoms appear. Years before you feel anything. It is a silent enemy, a thief of health that operates in the shadows. And it is acting in your body right now without you noticing. In more than 30 years as a cardiovascular surgeon, I have held human hearts in my hands. I saw the arteries of people aged 60 that looked like they were 90, hardened, calcified. It is a vision that never leaves my memory, which drove me to seek answers. And I always asked the same question: how did it come to this point? And the answer was almost always the same: silent inflammation, plus daily habits repeated for years. It was not an isolated event, a bolt from the blue. It was a pattern, a routine, a series of small choices that, when added together, led to a disaster. Have you ever stopped to think about your daily patterns? The little things you do without thinking? And there is a mistake that almost no one notices. An error that happens 3 times a day or more. An error that is in front of you on your table every time you eat, and it is invisible. Each meal can do one of 2 things: reduce pressure or silently worsen your arteries, feeding that chronic inflammation. And the problem is, most people are feeding the problem without knowing. Are you sabotaging your health with every bite without having the slightest idea? But the solution is surprisingly simple. So simple that it seems unbelievable. And it could be one of the most powerful changes you will make in your life. With a direct impact on your blood pressure and vitality, get ready to change the way you eat forever and for the better. The first solution lies in the order in which you eat. It seems too simple to be true, doesn't it? But science proves it. Eat vegetables first, always, before any carbohydrate, before bread, before rice. Why? Because the fibers create a barrier in the stomach. They slow down the absorption of sugars. This reduces the spike in glucose, the spike in insulin, and consequently, the contraction of blood vessels. Direct result: less pressure within the arteries. It is a smart strategy. Patients who combine this with slow chewing have even better results because the nervous system enters relaxation mode. The body understands that it is safe, that it does not need to fight or flee. This directly impacts the regulation of blood pressure. Are you ready to eat more intelligently and mindfully? But there is another secret, a simple ingredient that can be your greatest ally. And he is in your pantry right now: apple cider vinegar. Yes, that simple vinegar, 1 to 2 tablespoons diluted in water. With every meal, What no one explains to you, acetic acid improves insulin sensitivity, reduces glycemic spikes, and increases nitric oxide production in your body. And what does nitric oxide do? It relaxes your arteries. The biggest mistake is not using it. It's using it inconsistently. The benefits come with daily repetition. It is a habit that is built, a routine that transforms. Do not expect miraculous results overnight, but expect a gradual and powerful change. Are you willing to be consistent for your cardiovascular health? But there is a silent danger that acts while you sleep, an invisible enemy, and he is lurking in your downtime. Here is something that few doctors explain. Your blood pressure at night can be more dangerous than during the day. This is called nocturnal hypertension. It drastically increases the risk of serious cardiovascular events such as stroke and heart attack. Are you protected while you sleep, or is your body in silent warfare? The solution is surprisingly simple and delicious. 30 grams of walnuts before sleeping. Why? Walnuts are rich in omega-3, melatonin, and L-arginine. This powerful combination helps the body to shut down properly, to relax, to repair oneself. A small habit, a great protection for your heart and brain. But what if there was a tea that acted like a powerful remedy without the side effects? And it is delicious, affordable, and waiting for you. Hibiscus tea. Simple and powerful. 3 cups a day. Hibiscus tea. Simple and powerful. 3 cups a day. Studies show that it works similarly to a class of medications called ACE inhibitors. It reduces systolic pressure. A natural remedy in your cup, no prescription needed. It works even better when combined with reduced sugar. It's a lifestyle, a conscious choice. It's not just a drink, it's a health ritual. Are you ready for this tasty and transformative change? But there is an enemy in your kitchen disguised as a friend, and it is silently destroying your arteries. The wolf in sheep's clothing, refined oils. Most people cook with soybean, canola, and corn oil. These oils, when heated, create inflammatory compounds that fuel silent inflammation. Are you cooking with poison unknowingly? The solution is simple. Replace it with quality extra virgin olive oil, quality butter, or coconut oil. This completely changes the vascular environment, reducing inflammation and protecting your arteries. It is a simple yet powerful exchange with a lasting impact. Your kitchen can be your pharmacy or your poison. Which one do you choose? Remember that 67-year-old man with concrete arteries? His story has a surprising ending, and yours could too. That 67-year-old man, he didn't change everything at once. He did one thing at a time, small, consistent changes. 6 months later, went from 4 medications to 2. Blood pressure stabilized, energy restored, vitality back. He regained his life. He regained hope. He regained the future. And he told me something I have never forgotten, something that echoes in my mind to this day. Doctor, why didn't anyone tell me this before? That's the question I want you to ask yourself. That's the question that can change your life. Are you ready for your own transformation, to rewrite your health story? Before you leave this video, choose just one of these changes. Not 5, not all, just one, the one that resonated with you the most. And start today. Share this video with someone you love who needs this information. And tell me in the comments, which of these changes will you implement first? Your health is in your hands. Your choice makes a difference. This does not replace your doctor, but it could be exactly what was missing for your body to start responding. Subscribe and activate the bell for more health secrets, for more revelations. I am Dr. Andrew Collins, and I am here every day to bring you the best information. I'll see you in the next video with some new revelation. Your journey starts now.